Ah, Paul, how do you get on?
I don't know. What paper was it?
Mate, how did you get on with it?
I don't know. I don't know. As soon as the paper's finished, I blot it out of my mind. It's finished. It's over. I know it's over, but I can't remember doing a medicine paper.
Oh. Well, never mind, Paul. What exams have we got left?
I don't know.
Well, there are 3 hurdles to go. Obs and gynae clinical and surgery viva tomorrow, and the final surgery clinical on Friday.
2 tomorrow.
2.
Oh, right, come on, early night. Paul, your turn for prayers.
I can't remember it. oh, yes. Come on. We are poor medical students, helpless little lambs. Oh, Lord, please make us doctors and bless our last exam.
But you needn't bother about Michael Upton. He doesn't need your help.
Yeah, come on.
Good night, lad.
Good night, Phillips.
I can't remember.
Good
You're
night,
not still
Michael.
wearing that vest, are you?
Come on, Mike.
No, I've got to work. Coffee. I would better have some coffee.
I suppose you know you keep me awake at night.
I don't make any noise.
What? I can hear that feverish little mind of yours thundering away. And anyway, when you work, I just lie there feeling guilty.
I'm sorry, but I've got a very short memory. I have to read things up the night before in order to remember them the next day.
Well, you have a nice little sleep in the exam. That's what'll happen.
Oh, don't you worry. I know what I'm doing.
Wakey. Obstetrics at 10.
Come on, all hands to the pregnant ladies. Hooray!
What's the time?
9 o'clock. Have a good sleep.
I do not sleep well with the light on.
Has he been there all night?
All night. Come on, Mike. Mike!
What? Sorry. I'll go to bed now. It's all right, I'll go to bed now.
Yeah, you go to bed now. You've got time for a good 4 minutes kip before we go to the exam.
What? I don't feel very well. I'm so tired.
Ooh, surprise, surprise.
So, you'll be due on the 27th?
That's right.
Good. Well, now, do you mind if I just take a look at you?
Oh, surely. Sleepy?
A bit.
Right, you are,
Collier, sir.
you're Collier, are you?
Yes, sir.
Right, Mr. Collier, have you found anything unusual about this patient?
Yes, sir. She's rather pregnant, sir.
Rather pregnant. It's like saying someone's a bit dead. She's either completely pregnant or she's not.
Yes, sir. What I mean is this patient's only 7 months pregnant, but she looks full term.
Ah?
The size, I mean.
Yes. Well, now, have you found anything unusual about the baby's head or the limbs?
Well, yes, sir. There seem rather a lot of them, sir.
So what, you going to tell her that she's going to have an octopus?
No, sir.
Well, what then?
Twins?
Twins. Yes. Good. Excellent. That was an easy one, wasn't it?
Yes, sir.
Right, now, go and have a look at the lady in bed number 5, would you? She should fox you.
Yes, sir.
Have you heard the fetal heart yet, Doctor? Hear anything, Doctor? Doctor?
He's asleep.
It's too late for that.
It's never too late. Just learnt the incidence of pheochromatosoma among the Bantus.
Oh, really? What is the incident?
Oh, it's, Oh, hell.
Oh, hello, Mike. How did you get on in the obs and gynae?
I fell asleep.
You didn't.
I did.
What happened?
Well, he was very nice about it. I managed to answer all his...
You got on okay, then?
I reckon. This is the one I'm worried about.
What, surgery? Huh. It's a cinch.
It may be to you, but it's very hard work to me.
Mike.
What? Oh, sorry. God, who was that?
Sir Hartley Maynard. He's the one that failed Hooley out last year for not knowing who invented the Spencer Wells forceps.
Who did?
Spencer Wells.
Well, I only hope I don't get him.
Somebody'll get him.
Stuart Clark? Upton?
Yeah.
Waring? Follow me, please, gentlemen. Mr. Upton? In there, please.
Sit! Hey!
What's that?
Ah, that's a gallstone, sir.
Is it?
Isn't it?
I'm asking you.
Yes, yes it is.
It's a gallstone, is it? Where do you think we found it?
In the pathology museum, sir.
Do you want to fail this exam?
Oh, no, thank you, sir.
Then don't try to be funny. We found it in a gallbladder.
Yes, sir.
That's a little bag attached to the liver, you know.
Yes, sir, I know.
Oh, you've heard about the gallbladder, have you?
Yes, sir.
Amazing. This is one of your lot, is he? So, Mr. Upton, you know everything about the gallbladder, do you?
Yes, sir.
Indeed. Everything?
Well, not everything.
Why not?
Well,
Don't they teach you about the gallbladder at Swithins?
yes, sir.
Don't you think you ought to know everything about it?
Yes, sir.
Well, perhaps we ought to find out exactly how much you do know. Now, what sort of people get gallstones?
Well, typically they occur in overweight married women of middle age with a fair complexion and a history of dyspepsia.
You mean fat, fair, flatulent, fertile, and 40.
Yes, sir.
Then say so.
Yes, sir. Fat, fair,
All right, all right. Now, gallstones sometimes lead to inflammation of the gallbladder, yes?
Yes, sir. It's called cholecystitis.
I know. How'd you treat it?
Well, first by conservative treatment, rest, sedation, antibiotics.
Conservative treatment? Nonsense! You cut it out, man, you cut it out.
Yes, sir.
Who taught you all this rest and antibiotics rubbish?
Professor Loftus, sir.
Oh.
I think Upton would agree that there is a place for surgery if conservative measures fail.
Oh, yes, sir.
No, I'm afraid I can't agree with that.
I think Upton's right.
Oh, I grant you in a few special cases.
No, I should say in most cases, conservative treatment should be the first approach.
Nonsense. You should open them up immediately. After all, it might be an acute appendix.
Oh, well, if you can't tell the difference between appendicitis and gallstones.
You're not getting bored, are you?
No, sir.
Well, you agree then, don't you?
Well, Upton?
Well, do you?
Partly, sir.
Partly? What do you mean, partly? Either you chop it out or you don't chop it out, and I say you chop it out.
Only if all else fails.
As it will.
Will you let me make my point?
You're wrong, Loftus. Wrong. He's wrong, isn't he?
No, I'm not, and I think you'll find that most surgeons would agree with me.
The old methods are the best.
Perhaps you should learn some new ones.
Such as?
I can only suggest that you read my paper in the last edition of The Lancet.
Oh, that. I have read it. I found it most entertaining.
What do you mean?
I laughed all the way through it.
What did you say?
I laughed all the way through it.
Sir.
Shut up.
Yes, you keep out of this upshot.
Upton.
Quiet!
Now finished! It's all over! Finish it! Finish! No more exams!
But I haven't. Why, what you got left? I got one more this afternoon, the last one.
It's all over.
What happened? How'd you get on?
I don't know.
What did they ask you? Tell me, what did they ask you
I don't know, I've forgotten. But it doesn't matter. It's all over. It's finished.
Please, I've got a headache.
Oh, well, why don't you sleep it off?
Oh, very witty. No, I must keep working. I've got to stay awake.
Careful, you'll knock yourself out.
No, I've got to stay awake till 3 o'clock.
Well, that's not long. It's only 20 minutes.
What? Oh, God, why didn't you tell me? When's the next bus?
5 minutes, you'll be all right.
Where's the aspirin?
Right hand draw. And remember, Michael, when they ask you a question, don't snore.
Well, good luck, Mike.
Cheers, Mike.
Cheers.
You know, he's lucky he didn't flake out days ago.
He'll be all right now. He's nearly made it.
Yeah. Oh, no.
What?
This stupid Burke is only going to take me 3 sleeping tablets.
Paid your fare. 2 or 3, please. Thank you. Stop!
Good luck. And you. Good afternoon.
Hey?
I said good afternoon.
Oh. Hello.
Hello.
You what?
Hello.
Hello.
Right. Now, what seems to be the trouble?
Oh, no, not really, no.
No. What is the trouble?
Oh, yes. In there.
Oh, right. Well, let's see, huh? Uh-huh. Oh. Open wider.
I beg your pardon.
Open wider. Good. Yes, it's okay. Fine. Now, how long has it been there? No. How long have you had it?
Oh, yes. The first time I noticed it was when my wife had her bad hip.
Oh, yes. And when was that?
When she had a bad hip.
Yes, but, I mean, forget it.
6 months ago.
Oh, fine. Good. Has it given you any pain?
You are?
Have you had any pain?
Oh, yes. Yes, it was broken, you know. My wife's hip.
Yeah, open wide again, please.
Well, now, I think you've had long enough. And your name is?
Waring, sir.
Pardon?
Waring, sir.
Waringson? Oh, Waring, good. And what have you found here?
Oh, he seems to have something in the throat, sir.
Something what?
In the throat, sir.
Yes, good. And what do you think it is?
Well, actually, I'm not exactly certain, sir.
Quite right. Well done. It's right.
I'm what?
Pardon?
Oh, nothing, sir.
No, I've never seen such a good one either.
Oh, no, sir.
Yes. And what has he told you about it?
Oh, well, it's a bit difficult getting anything out of him, sir. He's rather deaf.
Oh, never mind. You've done very well. Thank you.
What's that?
He said thank you.
Oh, don't mention it. Now then, tell me, what do you make of this?
Thank you very much. Thanks a lot. You all right? You feeling all right? Sure? Well, here, thanks.
you can't be. God.
Help! 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 Quick, I think he's had a coronary. Anyway, it's a cardiac arrest, so go and call the crash team. And then come back in and help me. And for God's sake, hurry! God. Come on, come on!
I tell you, Dick, it was as big as a pineapple.
Well, never mind. It's all over now.
Yeah, we're finished. Oh, come on, let's go and have a jar.
No, hang on. Let's wait for Mike.
Oh, yes, he hasn't come out yet.
No, maybe they kicked him out early.
Hey, don't say he's fallen asleep in there.
Maybe they kept him behind.
Oh, they can't have.
Well, they could have done.
Have either of you two seen Upton?
No, sir, he hasn't come out yet, sir.
And no, he hasn't come out. He didn't even bother to go in.
Wasn't he in there?
No, he was not. What do you know about this?
Nothing, sir.
Something must have happened to him, sir.
Well, he'd better have a very good explanation. Because when I see him...
Have I missed it?
Upton!
Sir?
Would you kindly explain to me just what the hell you think you're doing missing an exam? Why weren't you there, eh? Just couldn't be bothered to turn up, or what?
Well, no, sir. You see, I fell asleep, sir.
You fell asleep?
On a bus.
On a... Ye gods, Upton, do you realize what you've just done? You just missed your chance of passing your finals. We spent God knows how long drumming the elements of medical knowledge into your thick skull, and what happens? You chuck it all away because you fell asleep on a bus.
Yes, sir.
Do you know how much it costs to educate a medical student?
Yes, sir.
How much?
I don't know, sir.
Well, it costs a hell of a lot of money. And you just throw it all away. Once, Upton, I thought you had promised, but this is the end.
But
What?
well, I can have a second chance, can't I, sir?
Not if I can help it, Upton. Not if I can help it. Oh, get out of my sight.
Wowee.
Never mind, Mike. He's probably just joking.
What happened, Mike?
Oh, it was this old bloke on a scooter.
They're up! No, I don't want to look.
I'm not there.
You can't see from here.
Yes, I can. I've got very good eyesight. I'm not there.
Well, I should be the first under W. What? Huh? Bruh? It's wearing! I'm a doctor, the mad fool! I'm a doctor! Good grief.
Aren't you ready? Oh, yes.
Oh, what's the matter? Well, Hooley's passed. I won 600 quid!
What? Don't worry, you can open a swish practice in Harley Street. You'll make a fortune.
Have I passed?
Have you done it, Paul?
I don't know.
Yes, he has!
Hey, what about little Michael?
I didn't notice. Look, it should be just above me.
No, he isn't there.
Well, he did miss that last exam.
Oh, that shouldn't matter, should it? I mean, he must have done well in all the others.
No, Upton's name's definitely not there.
Did you all get through?
Yes?
Yes,
right.
Great.
It must be a mistake, Mike.
Yeah. You'll be able to take clinical again.
Yes, next year. I can do it all again next year. But I can go and have a sleep now.
It's ridiculous.
Well, I mean, you heard what Loftus said. What can I expect if I miss a whole...
For heaven's sake, you had an excuse.
Oh, yeah, I fell asleep.
No, not that. The old chap. And if it hadn't been for him, you'd have only been 5 minutes late.
If it hadn't been for him, I'd have still been stuck in a bus depot.
Upton.
Is he there?
No, but, Loftus wants to see you in his office. Immediately.
Well, go on.
Come in. Ah, Upton.
Sir?
Upton, there's somebody here who'd like to thank you. Mr. Bradford, this is the young man.
Oh, thank you very much for what you did.
It was nothing.
It wasn't nothing to Mr. Bradford, Upton. You did save his life.
Yes, I'm better now.
Good, good.
Did you get to your exam all right?
Well,
No, he didn't. Nor did he tell me the reason why he wasn't there. Did you, Upton?
well, no, sir.
Why didn't you tell me, Upton?
Well,
Upton, the gift of speech is a valuable one, but you must learn to use it properly. I don't like you talking in my lectures, but if you've got something to say, I really wouldn't mind if you just opened your mouth and said it. So why didn't you tell me what happened?
well, you didn't give me much chance, sir.
Nonsense, you should have told me. Anyway, I've
Well, I
informed...
did
Don't
try.
interrupt.
Sorry, sir.
No, I'm sorry, Upton. Go on.
Well, I was just wondering if I could possibly take the exam again, sir.
No, certainly not. As I was saying, I have informed the Board of Examiners of the circumstances, explaining why you failed to attend your last examination, and I've received this reply. As you can see, they note that your failure to fulfill one whole section of your final MB examination would normally rule out any possibility of your passing.
Yes, sir.
However, in the circumstances, they are prepared to accept your explanation and regard your presence of mind and